Well, good afternoon, everyone. Good morning. Happy New Year to you. Welcome to a new year. I pray that the year started off well for you, that you're enjoying yourself, and that God is blessing you and keeping you. Today, we're talking about a very interesting topic, uh, Medicare plans that could possibly, not possibly in some cases, but that have actually dropped insulin coverage. I always stress the importance of always going over your plan. It's important. Yeah, last year's plan is completely different from this year's plan. And so there's been so much happening, with new laws being passed. And so I know many people were just excited when they heard, said, hey, insulin can the insurance companies can no longer charge any more than $35 for insulin. All right, and so that is the law. That is the law, uh, and that is the case. Um, but the caveat to that is that the insurance companies don't have to cover insulin. Right, they're not mandated to cover specific drugs, and so unfortunately, that's exactly what's happened. The insurance companies have said, some of the insurance companies have said, well, we just simply just won't cover the insulin. And so now many people may be forced to have to pay full price for insulin, which is something extremely needed for those with diabetes. And so we're going to talk about that. We're going to read it. And so I hope you stick with me for a little bit as we go through this and we go on this journey. So let's take a look. I'm going to share. We're going to go through this article together as we read this here. So give me just a moment to get my screen together. And I will share the screen with you. Share screen. All right, there we go. Um, as you can see here, this is articles written by USA Today, and they are giving us some information as to what's happening and how this operates. With Medicare annual open enrollment about to close December 7th, it's already closed. We're in January. Medicare experts are discovering many insurance plans are dropping some insulin coverage for 2024. In an informal survey of Medicare, 22 Medicare plans, 10 plans are dropping at least one insulin from their formulary. According to Diane Omendahl, founder of 65 Inc., which provides Medicare enrollment guidance through fee-for-service one-on-one consultations, 4 plans are dropping 4 more different insulins, she said. If you're banking on $35 out of insulin pocket cap to continue saving money next year, you must check your plan to see if insulin is still covered. So it's important, for you um, that you know exactly what your plan is covering, because it's essential that you know, because you may think that you may think that your plan is covered. Hey, but according to this, some of these plans have just said simply, we are just not going to cover this insulin. They just simply aren't going to do it. And so, unfortunately, that's exactly what's happening. And so, if you're banking on that $35, check your plan, get with someone who can assist you to see what's going on with it. Because the one thing you don't want to do is be caught without having your insulin. And now you're trying to go to the doctor, you're trying to get coverage, and you can't. Um, Plans have the option not to cover drugs. That's what's really huge there. That the plans have the options of not covering the drugs. And I think that you need to know that. You need to know that the plans that the insurance companies are not mandated to cover these drugs. So what does that mean for you? Again, you thought, hey, I don't need to switch my plan. I don't need to look at it. And I know it can become overwhelming because you're getting phone calls, you're getting bombarded. But it's very important that you sit down and that you look and that you go over it. It's going to be tough on people. People, if they discover later that insulin isn't covered and capped. So what does that mean? Again, it means that you may essentially be paying full price, which can be hundreds of dollars per month for your insulin. So why are the insurance companies dropping the insulin? It could be related to the Biden administration's changes to coverage. Some experts say could be. Who knows? I don't know, but some say that that could be it. Because of the insulin cap, we're seeing insurance companies responding to change to this change by adjusting medications they will cover. Dr. Carl Robinson, medical editor and drug price comparison at GoodRx. Some plans are choosing not to cover the insulin that comes with higher manufacturing costs or facing production challenges. In addition, the insulin cap cost sharing will be eliminated next year once enrollees reach the catastrophic coverage level. Or when out-of-pocket spending reaches $8,000. In 2023, beneficiaries paid 5% co-insurance or copays in some instances at the catastrophic level. In 2025, out-of-pocket drug spending will be capped at $2,000. While Medicare enrollees will save thousands, insurance companies will pay more and likely look for new ways to pass on the cost to make even more revenue, experts say. If these aren't reasons, it's very strong correlation, Omendahl said. So what should people do? People should check their Medicare plans now. You got to check your plan. You got to get on it. You got to look at it. Make sure if you need insulin, or not only insulin, but any other medication. You should be checking for all of your medications on a regular basis. You ought to be checking to make sure that these things are covered. And so you ought to be checking these plans. You ought to be checking to make sure that your medication is good, see how much it's going to cost you, to make sure that it's affordable, and to see if you may, if it's not, you may need to switch your plan. Okay. So Medicare Advantage enrollees can still change their plans during the Medicare Advantage open enrollment period from January 1st to March 31st. People should start at Medicare.gov and put every drug that they take and see if their plan will cover their drugs for this current year of 2024. So you ought to be checking your coverage, or hey, if you need some help, you can certainly reach out to us, give us a call. We'd be happy to help you, happy to look over this for you, and to take a look and see what's going on for you. But it's important that you know, because the worst time to find out is, you don't have the right coverages when you need it. And so if you use Levemir, you should know that Novo Nordisk has said it's discontinuing this insulin in 2024. Shortages could begin as early as January, so you should start looking for alternatives that insurance plans will cover. Okay, so you need to know. You need to take a look at it. It could cost hundreds of dollars or more annually and be catastrophic for over 1 million Americans. Among Americans who use insulin, 14.1 reached a catastrophic spending over 1 year and said defining catastrophic as more than 40% of income spent on insulin after paying for food and housing. Nearly 2/3 of patients experience that level of insulin spending with Medicare beneficiaries, the study said. So if you're happening to get stuck with a plan that doesn't cover your insulin, you may still have options. You can talk to your doctor to see if your doctor can assist you in applying for or prescribing rather an alternative or generic form of your prescription. So I would say, hey, you got to take a look at this. You have to make sure that you have what you need. Don't get caught out there and not have what it is that you need. Please, sir, please, ma'am, make sure that you're taking a look at this, making sure that you are handling your business, because this can be confusing. It can be tough, but understand that we're here to help, here to assist. And if you have any questions, feel free to reach out to us, and we'll be more than happy to help you navigate the system and ensure that your insulin is covered. It could very well be that your insulin still is covered on your current plan. And if so, that's excellent. But if you're one of those people, millions of Americans who are going to find themselves, unfortunately, in a position to where your insulin will not be covered, I would urge you to give us a call so that we can help you out, or get in contact with Medicare.gov. Figure something out. Just make sure that you're covered, because you don't want to be uncovered and need your medication and get down to the pharmacy and find out that now you have to pay a couple $100s on top of your testing strips, on top of your needles, on top of all the other things that you need. So please, please, please educate yourself, get some help. Any questions, feel free to reach out. We're happy to help, happy to answer any questions that you may have. God bless you. Have a wonderful day. And please have a wonderful year. Any questions, feel free to reach out. God bless and take care.